Dave Cassel is also a wonderful partner of ours from the Health Gorilla team. And we had lots of great conversations about how we help each other, how we plug gaps in the industry, and how we continue to kind of get this data element, this data source around clinical information and ADT feeds, into the hands of the consumers, into the hands of our customers, so that we can actually move the needle around data and move the needle around acquisition and move the needle about how do you actually use that data, because that's where we think our role is. We get it all together, but now we actually have to do something with it. Age-old problem, I know, because I've lived it for 40 years, 30 years anyway. But anyway, Dave, thanks. Tell us a little bit about yourself.
Sure, thanks. I'm Dave Cassel. I'm the Chief Customer Officer at Health Gorilla. I am proud to say that despite appearances and all the gray, I have not been in healthcare for 30 years.
Ouch.
No comment on how close I might be, but I have not been in healthcare for 30 years. But I have been involved in health IT interoperability since the late 90s in one fashion or another. Have seen a lot of change and a lot of things that unfortunately haven't changed since that time. We're still using HL7 version 2, for example, for those of you who are familiar with that standard. But in any case, some of my relevant experience in particular to my current role is that I spent about 6 years in the founding executive director role at Care Equality, which is a national exchange ecosystem. Health Gorilla actually, as the core of our platform, connects into a number of those national health information exchange ecosystems and other data sources, and provides a single point of connectivity for folks like the Garage and all those out there in the audience to be able to access into those data sources as appropriate.
That's perfect, thank you. So one of the things same type of questions, what do you think the impact is that Health Gorilla will have today and in the future on this space, on the healthcare space?
Yeah, well, with the Garage, we're just starting out. We had our first live use, I believe, over the past couple of months with a couple of initial clients. We're looking forward to getting more of your clients on our platform, in fact. But ultimately, and at the risk of stating the extremely obvious, you can't do value-based care without data. If you're trying to do value-based care with the same access to information that you would apply in a fee-for-service world, it's not going to go well for you. So what we envision is the ability to use the data provided via the Health Gorilla platform for all of the different things that providers are doing in the treatment realm as a primary use case, such as identifying gaps in care, identifying on the opposite extreme where there isn't actually a gap in care and you can avoid duplication, and also obviously being able to help with care planning, care management, and generally make sure that providers on the front line have access to the information when patients are, as they do, traveling about, going to see different folks, not necessarily appearing for care exactly where you might hope they would be, and making sure that that information is available. Then secondarily, obviously, there are many things you can do with the data from an analytics standpoint, as all of the wonderful tools that you've been seeing here highlight. As was mentioned, we do also provide ADT data. We see that as being very symbiotic with the other data sources. In particular, when do you actually go seek information from those data sources? Well, one obvious answer is that you know something occurred because you got an ADT notification about it.
Oh, that's great. And I think I've talked to many of you here talking about how ADT is so important to be able to capture that condition immediately and do something with it versus a month later when a claim gets through the process, right? So anyway, I really value the partnership with Health Gorilla. I think together we're going to go a long way. I know that you're still getting additional coverage space in the ADT world. Clinical data continues to get stronger and better. Super excited about the fact that you're part of the TEFCA organization. Have you gotten any sense about the whole TEFCA? Is that a 9-month process? Is it a year process? Or is it kind of an ongoing process?
Well, it's an ongoing process, but to be clear, the TEFCA is alive and well today. there is exchange occurring as we speak of records between organizations using that TEFCA ecosystem. At the same time, there's a gradual evolution that's going to occur, and there's a gradual building of the value of that specific network relative to the others. And that's why it's important to have someone like us who can connect you not only into the TEFCA, but also into those legacy data networks, which I call them legacy, but they're really where 80 to 90% of the information is going to reside today, with that number gradually starting to shift over to TEFCA, as in particular CMS incentives that we're expecting and other federal initiatives are going to drive adoption there. But we also see a number of other interesting things about the TEFCA. I alluded to this in my comment about primary versus secondary use of the data. There's a heavy reliance today on a treatment use case for disclosures of data to external parties for the legacy data networks, and as we sit today in TEFCA as well. But there is movement there and a strong desire on the part of the Office of the National Coordinator, ONC, which you may or may not be familiar with depending on your types of interactions with HHS, but they're intimately familiar to us in the health IT interoperability world. But there's a strong desire on ONC's part to drive direct disclosures of data, requests for information for the HIPAA-defined purposes of payment and healthcare operations in the TEFCA this year. There's a great deal that we can do, are doing under the auspices of treatment. There's even more that we can do if you can directly access data from all these data sources for purposes of healthcare operations. So we're looking forward to that.
Thank you, Dave. I appreciate it. Round of applause for both Dave and Brian. I really appreciate you jumping on. And any questions from?
Or Steve, everybody's curious about the coverage of the facilities that are feeding data to Health Gorilla, right? That's a question that we get from pretty much every customer that we work with. So can you throw some light on that? Where are you guys in terms of the overall ADT coverage and what to expect in the coming weeks, months?
Yeah, I'll distinguish.
I'll trade you.
I'll distinguish between, I'll get to all of that.
Sure.
Distinguish first between the national interoperability networks that provide access to those large swaths of medical data and ADT sources. In the former case, in terms of what's available through those national interoperability networks, it's probably close to 85 to 90% coverage of the data that's out there, because those who participate in those national networks tend to be the largest, highest volume health systems, plus the users of a number of the largest market share outpatient EHRs that focus on smaller ambulatory practices. So, for what it's worth. Then, Pranam, you asked mostly about ADT. The answer is, as you see there, that it does vary by geography. There is a fair amount of geographic variation. We are working right now to build on what you see there on the screen by having partnerships that we're developing with, in particular, health information exchanges, but other ADT data sources in general, so that we can continue to flesh out and fill in some of the holes in that map. So, for example, right now, you see that Pennsylvania has a lower coverage rate. We are, I'll say, very close to finalizing a deal that will change that, and we'll make Pennsylvania there a lot, I guess, darker blue in color. And that's just one example. There are others that we are working on in the same vein. So we do continue to add to the ADT data sources over time.
Thank you, Dave.
That's perfect. One last thing I will mention, because it's really important to understand we're all on a journey, right? Healthcare doesn't happen overnight. And one of the things I like about these partnerships that as they're growing and changing, we take and capitalize on those. Rest assured, if